about Clostridium tetani. So today again, our topic is gas gangrene, and the cause of the gas gangrene is Clostridium perfringens. So first of all, we must have to again know about what is Clostridium. So the main important points which you must have to know about Clostridium, number one thing, it is gram positive. Number one thing, it is gram positive. Number two, it is anaerobic, anaerobic rods. These are anaerobic rods, okay, and they are spore forming, okay. So Clostridium species, they are gram positive spore forming anaerobic rods, okay, and four type of Clostridium you all must have to know. First is Clostridium tetani. Second is Clostridium botulinum. Third one is Clostridium perfringens, which is our today's topic. This one. So third one is Clostridium perfringens. Okay. Third one is Clostridium perfringens, and fourth one is Clostridium difficile. Difficile. Okay, so we last time we studied about Clostridium tetani and Clostridium botulinum. I'm not going to go into the details of these topics, but I last time explained to you that both of the toxins of the Clostridium tetani and the toxin of the Clostridium botulinum, they are going to break down the snare proteins, and then they are going to block the neurotransmission at the एक मिनट मैंने मार्शल नहीं लगाया हुआ अंकित चौहान जहाज में बैठा हुआ है 1 सेकेंड ओके अंकित चौहान जहाज में बैठ के कहाँ जा रहे हो ओके so see here. So last time we studied about Clostridium tetani and Clostridium botulinum, and we said that these two tetani toxins, for example, the tetanus toxin and the botulinum toxin, they are going to act or break down the snare protein, which is going to involve in the neurotransmission at the neuromuscular junction. That's it. Okay. And one more point about Clostridium botulinum. Please remember, whenever you have a clinical scenario of Clostridium botulinum, there will be, you can say, scenario in relation to some food or canned foods. Okay. So there will be patient is using some time of a canned food, and after that canned food, he get symptoms. So it is a clinical scenario in which the patient is using the canned food, or in neonates when you are going to give them honey, okay, resulting in floppy baby syndrome. Okay, so these two scenarios you must have to remember in relation to the Clostridium botulinum. Okay, so our next two are third one is the Clostridium perfringens, and last one is Clostridium difficile. Difficile. Okay, so before going into the Clostridium perfringens, I want to tell you about that Clostridium difficile has two toxins, toxin A and toxin B. So if any, for example, Clostridium difficile, it is starting from the word D, so it will cause diarrhea. Okay, and when it is causing diarrhea, please remember it is forming two type of toxins, toxin A and toxin B. Okay, which is going to damage the cells of the intestines, resulting in watery diarrhea, and it can lead to pseudomembranous colitis. Okay, and the treatment for this disease is oral vancomycin or metronidazole. Okay, so just remember these main points relating to the Clostridium difficile. Yes, it is gram positive. Yes, it is spore forming. Yes, it is anaerobic. Okay, but more important points relating to the Clostridium difficile, which you must have to remember, that is It will cause watery diarrhea. It has two toxins, toxin A, toxin B. It will result in a formation of pseudomembranous colitis. Pseudomembranous colitis can also be caused by an over usage of antibiotics also. Okay, especially which antibiotics? Clindamycin, ampicillin. Okay, so if you are using antibiotics in large quantity, it can also cause you pseudomembranous colitis, and the treatment is oral vancomycin or metronidazole. Okay, so these are the points which I want all of you to remember in relation to Clostridium difficile. Okay, so now coming to our today's topic, that is Clostridium perfringens. So when I explain you in last lecture perfringens, see here, you have this P letter. So Clostridium perfringens, it will perforate. So first thing what you must have to remember in relation to the Clostridium perfringens, it will perforate a gangrenous leg. Okay, it will perforate a gangrenous leg. अगर आपको कुछ भी याद नहीं होता तो कम से कम ये लाइन जरूर याद होनी चाहिए. It perforates a gangrenous leg. And how it is going to act? See here, it is also a gram positive anaerobic spore bearing bacilli or the rods. Okay, and particularly in soil and feces, it is relevant to the military and traumatic surgeries and colorectal operations. Which persons are you can say predisposed to this infection? They are immunocompromised patients. They are diabetic patients. So please remember, patients who are immunocompromised, patients who are diabetics, or patients having any malignant disease or malignant cancer, they are at risk of getting the infection from Clostridium perfringens. Okay, from Clostridium perfringens. And what particularly if the wound containing a necrotic or foreign material resulting in anaerobic conditions. So military wounds are an ideal environment for such type of infection. So mostly in the clinical scenario, there will be some military wounds which they are going to give you, and you must have to think of Clostridium perfringens. Or they can give you a clinical scenario in relation to the patients who are immunocompromised, or patients who have uncontrolled diabetes, patients who have diabetes for lot of years. Okay, chronic disorders, malignant disease. Please remember, malignant, benign and malignant cancers. Malignant cancers are those cancers which grow very rapidly. They are not encapsulated. They are involving the lymph nodes also, and they can result in metastasis also. So these are the characteristics for your malignant disease. Okay. So please remember these points. These points are very important. Okay. After that, second slide, see here. So what is going to happen here? First thing what you must have to remember that Clostridium perfringens, it is going to form alpha toxin. Okay. For example, हमने when we studied about tetanus, we say that tetanus is going to form tetanus toxin, botulism is going to form botulism toxin, Clostridium difficile is going to form toxin A, toxin B. Okay, but if anyone is going to ask you what is the name of the toxin of the Clostridium perfringens, the name is it will produce this alpha toxin. Okay, and this alpha toxin, please remember, it is going to cause myonecrosis. Okay, it is going to form myonecrosis. Okay, myonecrosis mean what? It is going to destroy the muscles, necrosis of the muscles. Okay, and it will result as, see here, it will, when it is going to form myonecrosis, it will result in a formation of soft tissue crepitus. Soft tissue crepitus. crepitus. What is crepitus? When there is air present under the skin. Okay. So see here, the cavitation which follows the passage of missile through the tissues causing in entry wounds, leaving the clothing environmental swelling to the wound in addition to devascularized tissue. So what is going to result? Gas gangrene. Wound infections are associated with number one, local wound pain and crepitus. What is crepitus? That is gas in the tissues, which may also be noted here. Okay, so gas in the tissues, gas in your soft tissues. Okay, the wound produces a thin, brown, sweet smelling exudate in which gram staining bacteria will be revealed. Okay, there will be edema, there will be spreading gangrene following the release of collagenase, hyaluronidase, and other proteases and alpha toxins. Okay, so see here, Clostridium perfringens, how it is going to occur? Military wounds. If the wounds are not going to be, you are not going to clean the wound properly. If there is a very large number of devitalized tissue present there, foreign bodies present there, and the patient is immunocompromised or patient is diabetic, so it can result in gas gangrene. And what is going to happen? The wound patient will have severe localized pain, and there will be presence of air under your, you can see here in the slide that there will be presence of crepitus, that is the gas formation, because this Clostridium perfringens, it is going to form this alpha toxin, and this alpha toxin, it is going to destroy the muscles, resulting in myonecrosis. Okay, so there will be bacterial infection of the muscle resulting in gas production that is known as crepitus. Okay, so this is known as crepitus. Now see here, this is the picture which I want you to please remember it. So they can give you now a picture of the patient also, and these are the crepitus. These are the crepitus. See here, gas present here. Okay, so this is your Clostridium perfringens. Okay, caused by Clostridium perfringens, gas and smell are characteristics. Immunocompromised patients are mostly at risk. Antibiotic prophylaxis is essential when performing amputations to remove dead tissue. If the muscles are dead, you have to go for amputation. So you must have to perform amputations. Okay. Antibiotic prophylaxis should always be considered in patients at risk when amputations are performed for peripheral vascular diseases with open necrotic ulceration. Okay. But please remember, once gas gangrene infection is established, large doses of IV penicillin and aggressive debridement of affected tissues are required. So please remember, first thing what you must have to do, you have to clean the wound of the patient. Okay. So, so this infection cannot be occurred. So debridement of the wound is very important. You have to give IV, you can say antibiotics to the patients. And if there is a myonecrosis, if there is a gas formation, crepitus present, you must have to go for amputation. You must have to go for amputation because already myonecrosis is occurred. You cannot reverse this process, so you will go for amputation. Okay, so please remember it. It is a very important point which you must have to remember. And one more thing. Okay, next slide. See here. So there are other types of infections. See here, synergistic spreading gangrene. Okay, so this synergistic spreading gangrene, it is not caused by Clostridium. It is caused by other group of microorganisms. Okay, so you must have to know about this gangrene also. So gas gangrene, yes, it is caused by Clostridium perfringens. It is the alpha toxin. It is the formation of it is results in myonecrosis. It results in you can say crepitus in the wound also. But there is another type of synergistic spreading gangrene which is not caused by the Clostridium. It is a mixed pattern of organism responsible for the gangrene. For example, staphylococci, bacteroids, anaerobic streptococci. Okay. all have been acting in the formation of these gangrenes. And please remember this slide. This point you must have to remember. If the abdominal wall infections are present, it is known as Melanese synergistic hospital gangrene. And if there is scrotal infection, it is known as Fournier's gangrene. Okay, so if there is a scrotal infection, it is known as Fournier's gangrene. If it is an abdominal, anterior abdominal wall infection, it is known as Melanese synergistic hospital gangrene. But it is not due to the Clostridium. It is a mixed pattern of, you can say, microorganisms. Okay, and mostly it is occurring in the hospitals. Okay, so see here, this is an example of that synergistic gangrene, which I am showing you in the diagram here. Okay, so अभी कौन आ रहे हैं? Who is entering? Still anyone is entering here. So patients are immunocompromised with conditions such as diabetes. The wound initiating the infection may have been minor, but severely contaminated wounds are more likely to be the cause. Okay, there will be severe wound pain, signs of spreading inflammation with crepitus, and smell are all the signs of the infection. I explained one clinical scenario. I think I explained to my practical classes also that we have one patient of diabetes. This whole foot we must also. It will, you can say, to look after their going to clean the wound, debride the wound. See here, the edges are very far from each other. You cannot close the wound immediately because you will allow this whole wound area to be get there will be to be get normal. So there will be formation of granulation tissue, and then you can open close this wound. So please remember, first thing, yes, you are going for antibiotic therapy with aggressive circulatory support, then there will be wide excision of the necrotic tissue. If the tissue is dead, you must have to remove it. There is no reason to retain that tissue because that necrotic tissue is never going to become healed. And debridement is very important. So you have to clean this whole wound, and then you must have to let this wound so that this wound will become healed. So it's not primary intention, it is healing by secondary intention. Okay. But as you see in this diagram that this is a large wound, so you cannot oppose the edges of the wound. So you must have to place here graft. You must have to place here graft. Okay, so after healing, after formation of granulation tissue, when the condition is a little bit normal, then you can place the graft and close the wound of the patient. But before that, you must have to debride the wound, you must have to clean the wound, you must have to give antibiotics to the patient, you must have to give fluids to the patient. And when the wound becomes properly healed, then you can go for skin grafting. Okay. Next one is our leg ulcers. So leg ulcers, please remember, it is the most common chronic wounds. Okay. And how you are going to define the ulcer? Please remember, it is a type of our chronic wounds. It is a type of our chronic wounds. Okay. It is a defined as a break in the epithelial continuity. And what is going to be formed? See here, a prolonged inflammatory phase will lead to the overgrowth of granulation tissue, and attempts to heal by scarring will leave fibrotic margins. Okay, so please remember necrotic tissues often at the ulcer center is also called it as slough. So leg ulcers, what you must have to remember, number 1 point, it is defined as a break in the epithelial continuity. You are going to also study about the peptic ulcer. Okay, peptic ulcers, for example, the gastric ulcers and the duodenum ulcers are under the category of the peptic ulcer. So these ulcers are also the same thing. It can be defined as a break in the epithelial continuity. And how it is going to form due to prolonged inflammatory phase. So prolonged inflammatory phase will result in the formation of these ulcers. Okay. So what is the etiology of the ulcers? See here, it can be due to venous disorders, it can be due to arterial disorders, it can be due to any autoimmune disorders, It can be due to the trauma, it can be due to some chronic infections, or it can be due to neoplasm or cancers also. Okay, so all these things can lead to the formation of leg ulcers. Mainly lupus of leg ulcer. But one very important point which I want all of you to remember here, see this one. If the leg ulcer, please write this line everyone. If the ulcer is unresponsive to dressings and your simple treatments, you are giving antibiotics, you are cleaning the wound, you are cleaning the dressings of the patient, and still if it is not healing, you must have to do biopsy of this ulcer. You must have to do biopsy of this ulcer because it is known as Marjolin's ulcer. So please remember, if they give you a clinical scenario of any type of leg ulcer, any type of leg ulcer, even it can be caused after burn injury also. Okay, it can also be caused after osteomyelitis also. Okay, for example, cloaca opening. You remember I explained you cloaca. So it can also, if you are not going to treat it properly, it can also result in a formation of this squamous cell carcinoma known as Marjolin ulcer. Okay, so please remember they can give you a clinical scenario that patient is having a leg ulcer and you are changing his dressing, you are treating that patient. For example, you are treating for diabetes, you are treating for SLE, or you are treating for tuberculosis or syphilis, but still it is not responsive to your treatment. So if this type of scenario is come, it is your squamous cell carcinoma, and its name is Marjolin ulcer. Very, very important. Please remember it forever. So this is the point which I want all of you to remember forever, because this is the question which they can ask in your examination. So any type of chronic ulcers which is unresponsive to your dressing, then simple to say you must have to perform biopsy. Okay, please remember, whenever there is any cancer, you must have to go for biopsy. You will take a piece of this tissue here and you will send it to the lab for biopsy. Okay, to see for any neoplastic changes. And squamous cell carcinoma, known as Marjolin's ulcer, being the most common. So this is the MCQ which they can ask you in your examination. Please remember this point. Okay. Then effective treatment of leg ulcers depend upon the treatment of underlying causes. Okay. So if it is due to diabetes, you have to treat the diabetes. If it is due to the autoimmune disorders, you have to treat the autoimmune disorder. If it is due to the varicose veins, you must have to treat the varicose veins. Okay, so please remember, you are not going to just change the dressings and debridement of the wound. It is not going to help the patient. Okay, so if patient is developing the leg ulcer, yes, you have to look after the wound of the patient. But important thing is what, that you have to treat the underlying cause. The patient is having varicose veins, you have to treat varicose veins. If patient is having diabetes, you have to treat diabetes. If patient is having SLE, systemic lupus erythematosus, you have to treat SLE. Okay, surgical treatment is only indicated if non-operative treatment has failed. Mesh skin grafts we are going to use because they have the advantage of allowing mobilization, as any tissue exudate can accept through the mesh. What is mesh skin graft? See here. For example, you take a graft and you will make here holes in the graft. If you see any graft picture with holes in it, it is known as mesh skin graft. Okay, and they are more successful as compared to the sheet graft, because what, when you place this graft on the area, see here they have pores in here. So what, whenever there's any exudate or tissue fluid is going to form, it will passes through these pores outside. Okay, so that's why they are more successful as compared to your sheet grafts. Okay, so you can use these mesh skin grafts also. Okay, next is our pressure source. So what is pressure source? Till now everything is clear. Everything is clear. Okay, see here. What is pressure source? It can be defined as a tissue necrosis with ulceration due to prolonged pressure. See here the slide. So there is the formation of ulcer, but due to prolonged pressure. Okay. For example, leg ulcer, which we studied before this pressure sore, it is due to any disorder. It is due to diabetes, it is due to trauma, it is due to SLE, tuberculosis, other things. But this pressure sore, see here, it is defined as the tissue necrosis with formation of ulcers due to prolonged pressure. Due to prolonged pressure. They are also known as bed sores. They are also known as pressure ulcer. They are also known as decubitus ulcer. Okay. And please remember, they are preventable. There's no, okay, yes, there's treatment, but main thing is precaution. Main thing is precaution. You must have to take a good care of patient in such a way that the patient will not develop these pressure sores. For example, patient cannot move his limbs. A patient is in the bed, is in critical condition. He cannot move it. So you must have to change his side. You must have to move the patient so he is not going to develop these pressure sores. So whenever you are going to write the treatment of pressure sores, please remember you must have to write that that it is a preventable disease. You must have to prevent it. If, for example, you are working as a surgeon or as a doctor in a surgical ward and your patient develop this pressure sore, you are responsible for it. Nurses are not responsible for it. You are responsible for it. Why? Because you have to look after your patient. Okay, and see the higher incidence it is in paraplegic patients, paralytic patients, in elderly patients, and severely critically ill patients. So patient is paraplegic, he cannot move his limbs, he can develop these pressure sores. So you must have to change his sides. Okay. For example, in new books now it is written that they have some special types of beds present, uh, and these beds they cannot develop these pressure sores, but we don't have these beds here in city hospital here. I don't the heel, okay, malleolus, occipital part. Okay, so these are the pressure sore frequencies where they can develop. So it can develop in the ischium, it can develop in the sacrum. The last slide which I show you, that is the pressure sore developing in the sacrum. Okay, it can develop in the heel, in the malleolus, and in the occipital region. So if the patient is in this lying position, patient can develop these ulcers. Okay, so you must have to change the sides of the patient. शांत कुमार सिंह किधर फिर रहे हो? शांत कुमार सिंह गाड़ी में कहीं फिर रहे हो? Okay, so you must have to change the sides of the patient. Okay, these are the stages. But see here, if the external pressure exceeds the capillary occlusive pressure over 30 mm of Hg, blood flow to the skin will stop, leading to tissue anorexia, necrosis, and ulceration. Okay, so if external pressure, for example, patient is lying on the bed, and if the external pressure exceeds over 30 mm of Hg, blood flow to the skin will be stopped, leading to anoxia, necrosis, and ulcer formation. So if you are going to work in a hospital, please you have to look after these critically ill patients because they cannot move their, you can say, they cannot move it. So you must have to look after it. Prevention is obviously the best treatment with good skin care. Okay. So good skin care and prevention is the best treatment. And this is the point which I want all of you to remember. How you are going to prevent it. So in bed bounded patient, you should turn the patient at least every 2 hours. So if the patient is a bed bounded patient, he is severe elder patient, 75, 80 years old, he is critically ill patient who cannot turn himself, you must have to turn him at least every 2 hours to prevent pressure sores, to prevent bed sores. If the patient is on the wheelchair bounded patient, you must have to taught to lift themselves off their seats for 10 seconds every 10 minutes. Okay, because he is going to sit on the wheelchair. When he is going to sit on the wheelchair, he can develop also these sores. Okay, so this point, please remember, yes, number one thing what you must have to remember that prevention is obviously the best treatment with good skin care. Okay, we don't have these air fluid beds. Okay, maybe in Europe they have these air fluid beds, but I don't think that we have these beds here in India or in Kyrgyzstan or in Pakistan. I don't think we have such type of beds because these beds are very expensive beds. कोई 25 $15-20 का तो एक बेड. Please, if you are okay, so please remember these points. Bed bounded patients should be turned at least every 2 hours. Wheelchair bounded patients, they must have to lift off their seat for 10 seconds every 10 minutes. So please remember, you must have to prevent the formation of these pressure sores or bed ulcers. I know one thing that in our city hospital, in our last, I think more than 50, what is vac therapy? This is your vac therapy. Vacuum assisted closure to provide a suitable wound for surgical closure. So what is vac therapy? The aim is to fill the dead space and to provide durable sensate skin. Large skin flaps that include muscles are best and occasionally an intact sensory innervated area can be included. But please remember, back therapy when you are going to use, patient must be clinically stable with good nutrition. I show you first of all one slide, next slide, then I will explain to you what is vac therapy. See here in this slide. So whenever you are using vacuum assisted closure, you can see here, you must have to clean the wound. You must have to debride the wound. Please remember, this is a very important one. For example, if the wound is infected here and you close it with vac therapy, because this is vac, this black structure, see, it completely covered the wound. So you are going to place the vac here like this. And then you are going to apply the pressure. The pressure which you must have to remember is minus 125 mmHg. This is a very important point which you must have to remember. Back therapy, there will be negative pressure minus 125 mmHg. Okay, but important thing what you must have to remember is what? That whenever you are placing this vac or doing this vac therapy, you must have to clean the wound first of all. If you are not going to clean the wound is never going to be healed. So first thing before using the vac therapy, you have to clean the wound. See here in this slide, you have to clean the wound. And after cleaning the wound, if you are not going to properly clean the wound and if there is any dead necrotic tissue present, in the vac therapy because you are going to close the wound under pressure of minus 125 mmHg. It is not going to be healed. It is going to become more infected. It is a contraindication of vac therapy. Okay. So first thing what you must have to remember, you have to clean the wound, you have to debride the wound. After complete debridement of the wound, cleaning of the wound, then you can apply this vacuum assisted closure, and then you will apply pressure of minus 125 mm of Hg. Okay, and then it is going to become healed properly. Okay. So please remember, VAC therapy we are using in pressure sores also. We are using also it in patient with osteomyelitis also, chronic osteomyelitis also. Okay. So it is